We want to think pulling those shoulder blades down and back towards our back pockets. And then we're simply just going to breathe into the band. It's going to be a subtle movement. Hey, so today we're going to talk about breathing into your back, which is a really difficult thing to do. So we have a tool here today, a band. Okay, so what we're going to do is we're going to take this band and wrap it around our back. All this is going to do is provide our brain a nice little tactile cue or a little bit of a stimulus to kind of connect the dots to an area that we're not used to normally using. It's just a little bit of a helper. If you don't have a band, you can also just use like a leather belt or something like that, although the band is best because it does have a little bit of elasticity. So what you're going to do is you're going to get kind of on your hands and knees here, and then you're just going to sit back, okay? From here, you're going to take the band, wrap it around the small of your back. So that's going to be below your rib cage, which ends here, but above your pelvis, it starts here, right in that little fleshy notch. From here, you're going to take the loops, put them around your thumbs, and then we're going to sit forward, put our hands flat on the ground. From here, we want to think pulling those shoulder blades down and back towards our back pockets. And then we're simply just going to breathe into the band. It's going to be a subtle movement. There's not going to be that much room to move back there. And honestly, you might be not that good at it to start. It's a really weird movement. If this is not something that you're used to doing, your brain may not even know where to go to even start. But that's totally fine and totally normal. We just want you to have the intent of trying to breathe back there. And even if you can't do it, you're gonna help your nervous system and your brain connect those dots. And then someday soon, you'll be doing it. So if you're struggling and can't really feel it that well, just keep thinking about what we've talked about before of keeping the pelvis in line or parallel with the rib cage so that way you can actually breathe 360 degrees, and just do your best, okay? Shoulders down, breathe into the band. You got this.